Christina, and I will be presenting on the ID approach to veterinary nursing and pharmacology. We'll be discussing my instructional design problem, learning theory-based solutions, characteristics of learning, and the adult learner. My instructional design problem is addressing the pharmacologic knowledge gap amongst veterinary nurses in the emergency and critical care department while working in patient care. Ideally, nurses should have a strong understanding of anatomy and physiology to be able to perform patient evaluations and determine when a patient requires medical intervention. Nurses should have a strong understanding of disease states and the medications indicated for use, as well as the pharmacokinetics of those medications to be able to discern expected or unexpected side effects. Nurses should also be able to prepare and administer medications while keeping in mind drug compatibility to minimize complications from drug administration. Finally, nurses should possess strong patient advocacy skills in order to act quickly to alert the team if a patient is decompensating. However, currently the nurses have incomplete understandings in the following subjects: in anatomy and physiology, disease states, medication indications, pharmacokinetics, medication contraindications and side effects, drug administration, patient evaluations and interventions, as well as patient advocacy. Because nurses are lacking in patient evaluation and patient advocacy skills, there is often a delay in alerting the team in a patient that is decompensating slowly. However, once a veterinarian is alerted, there is a heavy reliance on the veterinarian to decide on next steps for intervention, resulting in delays in medical interventions and drug administrations. Urgency or lack of familiarity with the medications also results in errors in administration. Consequences in these delays and errors can result in deterioration of patient conditions and increased morbidity and mortality rates. Administration and compliance errors in drug administration can result in veterinarians' loss of DEA licensure, fines, and legal repercussions, amounting to the hospital's inability to treat patients. To Ertmer newbie, as people progress in their learning on a low to high continuum, the most appropriate approach to instruction may change. Those who are starting out, or green as we say in the nursing field, may benefit from a behavioralist approach, while more advanced experienced nurses would benefit from a constructivist approach. The behavioralist approach to learning theory suggests that learning occurs through interactions with the environment. The role of the learner is more passive as they interact with the environment that is set up by the instructor. The instructor provides feedback to reinforce behavior. The best type of learning for behavioralists is instructional cues, practicing, and chaining events in a sequence. Here is a relatively recent example of a behavioralist approach to learning. The example is a CPR simulation in which participants are actually expected to follow an algorithm that is listed step by step. They're asked to memorize waveforms such as this one, and once they see a waveform such as this, it elicits in response. Ertmer newbie, the cognitivist approach to learning theory puts more emphasis on the role of the learner, as the learner receives and organizes information, then stores it as memory and retrieves that information at an appropriate time. The role of the instructor is to aid in organizing information and provide feedback to support and guide informational processing. The best type of learning for cognitivists is reasoning, problem solving, and informational processing, the goal of which is to transfer knowledge. Going back to my example of the CPR simulation, the cognitive approach to learners may be applied as learners receive and organize information in a variety of ways. One such method may be in pictures and flowcharts. Another might be in the evaluation of written studies. The learner gains a more thorough knowledge of why a waveform may appear as it is, and utilize previous knowledge of pharmacokinetics to deduce which drug might be most beneficial in this CPR scenario. To Ertmer newbie, constructivist theory to learning is that it's filtered through the perspective of the learner as the learner creates meaning in the instruction. The role of the instructor is to guide in the construction of knowledge, as well as to monitor, evaluate, and update those constructions. The role of the instructor is to design the experience for the learner so that it is authentic and relevant. The best type of learning for this are problem solving, collaboration, and the demonstration of multiple perspectives. Constructivist approach to learning may be very beneficial for veterinary nurses as they have to take into account anatomy and physiology and a multitude of other factors such as disease states, pharmacokinetics, medication side effects and contraindications, as well as medication indications. And having gathered all that information, the veterinary nurses are then able to evaluate the patient, advocate for the patient, and develop a rapid response. This will result in reduced errors, improved patient outcomes, DEA compliance, continued high-quality care of patients, and overall improved staff morale, as well as improved staff retention. An example of the constructivist approach to learning theory. The nurses here are debriefing after a case-based simulation by which it provides meaningful context. Here they are reflecting upon the occurrences of the case and talking through areas that may need improvement. The discussion allows for the nurses to construct new knowledge to apply to future real-life scenarios. Their collaboration provides support for one another as well as maintains accountability of skills. Reflection and discussion of case studies or simulated scenarios allows for self-directed learning, supporting Knowles' first assumption that as a person matures, his or her self-concept moves from that of a dependent personality towards one of a self-directed human being. According to Miria and Barima, as adults mature, they are resistant to those who might impose their will without being able to offer input. During this debrief, everyone is able to speak and offer their input on what went well and what needed improvement. Each person is encouraged to ask questions, openly discuss the decision regarding timing and administration of medications, thus alleviating feelings of resistance and resentment towards the learning process. Taking into account Knowles' second assumption of adult learners, the discussion is also an opportunity to acknowledge previous life experiences and learn skills. Miriam and Barima wrote, "Experiences are a part of a person's identity. Therefore, to devalue a person's experience can be perceived as rejecting the person." During the discussion, the nurses will also hold each other accountable so they may learn from each other, all with the aim to act as a cohesive team. This supports Knowles' third assumption of the adult learner, that knowledge is more readily received by adults if they know there is a direct application to their role. The case-based studies also provide teachable moments, which supports the fourth assumption of adult learners. Motivation to learners often corresponds to an immediate need to solve a problem. In conclusion, to address the ID problem of veterinary nursing pharmacologic knowledge, the behavioralist, cognitivist, and constructivist approaches are all beneficial towards the learning process.